as we continue our discussion on coronavirus, we'll be looking at the health insurance perspective on the virus in Nigeria.
All right, joining us now, is the MD and CEO of Health Partners, who is also a member of the Technical Committee of Health and Managed Care Association of Nigeria. I'm sure I got that correctly. Real quickly, we'd like to talk to you about this, Doctor. Is there a gamut about health insurance for infectious disease? Is there a gamut about it? Because a lot of people argue and say, okay, yeah, infectious disease, then there's funds set aside by the government. You have to be in a certain place to be able to monitor and contact tracing and the like.
Thank you very much. Thanks for having me. Health insurance covers a lot of infectious diseases. However, when we have a novel disease that is just coming out for the first time, it's never been documented, it becomes a global public health issue, which goes beyond what the scope of health insurance might be able to cover at that point in time. So you have government actually taking responsibility to ensure that the disease is properly managed, controlled, and treated, as it were. And that's what we're having now with COVID-19 that came in December 2019. So health insurance has cover for infectious diseases that have established treatment protocols, that are already established. They have drugs, they have vaccines, they have all those things. But when we have a novel disease like this, it's usually something that government, states, international, federal governments, and also international bodies come together to actually solve, because it's a global public health issue. It's beyond the scope of any private organization to manage. And that's the situation we are facing now with COVID-19. So I would say health insurance has some cover. But in cases like this, we have intervention from all levels of government, locally and internationally, addressing this issue.
Do you think this is something we should be pushing for, set aside funds for? Because we would always have these outbreaks, whether we like them or not, as long as we have climate change, human behavior, ecological problems, we would have disease outbreaks. So is this something we should be pushing for, to set aside, a special sort of health insurance for disease outbreaks?
Well, I will say that it's not easy to actually put insurance to bear when it comes to things like this that are novel. And the reason is because for you to insure something, you must know what it is.
Exactly.
You must know the scope. You must know what is required to treat it. You must know the cost and who and where it can be treated. And those are the things that go into planning and designing health insurance plans and all that. So health insurance will cover what is established, what is known. But when we have instances where we have outbreaks like this, we rely on support from the health community cross-board to actually come together in a concerted manner to actually address it. Because right now, as we're speaking, there's no treatment for it. The vaccines are in one stage or the other of some level of trials, and the WHO and other international bodies are trying to fast track with a lot of funds, I would say, to make sure that it can come out on time and it can be used to address the disease. And that's always the case in cases like this.
Let's talk about some things. I want case studies based on infectious diseases you use your health insurance plan to be able to cover. And what did you treat particularly? Was it just giving analgesics and, just treating past symptoms you did? And secondly, there's a very low health insurance threshold in Nigeria. I mean, pervasively is the corporate sector. In fact, the National Health Insurance Scheme launched by Olusegun Obasanjo many years ago, despite all the money being popped in, just only have 3% of people using it. So what's the qualms about health insurance? Why are people not coming on board? And those case scenarios about the things you've done before.
Thank you very much. For coverage to actually rise, to be substantial, a lot of factors come into play. The government has good intention. There's no doubt about that, and you can see that by the fact that the National Health Insurance was established a long time ago to make sure that this goal is realized. But you have to also see that to have that goal realized, there are a lot of factors that come into play. Where is the funding going to come from, and how is that funding going to be arranged in such a way that the funds for provision of healthcare services are actually running smoothly without no disruptions. Right now, what has been done is to be able to establish like a pilot. That's what the government is able to do with the Federal Civil Service scheme, And also the private sector has been able to drive coverage with corporate organizations. Now what needs to do is to widen that net to make sure that all the groups of people that are not covered before are now covered. But the idea is there are funding. Where are we going to get the funding from? And a lot of approaches are being looked at the moment by the NHIS scheme in conjunction with other stakeholders to address these funding gaps so that funding can be arranged in such a way that is free-flowing and services can be procured and people can be covered across board. So I would say there was a funding issue, having a structure that actually makes that funding available. The one for federal civil servants was possible because there was a medical allowance that federal servants used to have, which was actually converted to that fund, and it's actually doing that at the moment. But for people that are in the informal sector, people that work, they are living every day, it's not easy to get them to have some contribution that can be consistent because you need to be able to track those funds and get them to not default. But there are schemes now that are trying to see how that can be resolved. We're also looking at maybe there's a form of taxation can be used, other strategies. For example, some countries have tried some percentage of VAT to provide some form of basic care for their populace. That's what was done by Ghana. Ghana took a percentage of its VAT, and that's what it used to provide basic health care for all Ghanaians. And you can now buy something on top of that. If you want some other services, you can procure from the private sector. So there are many approaches we have.
The case scenarios. Let's talk about the case scenarios real quickly of how you use health insurance. You talked about SARS earlier.
For disease outbreaks.
Yes, there's some disease conditions at that time that came out that we, under health insurance, were able to manage because most of these conditions need supportive care. Where there are established protocols by the state government or federal government to say we have an isolation center, and this is where people will need to be brought to for quarantine, for treatment, and all that. We have to comply. We have to comply with that. So even if the person has health insurance, the health insurance company and the provider must actually notify the health agencies that have that responsibility, and they will take over from there. So even for SARS, I remember, I think there was a case in Lagos at that time, either SARS or bird flu, that was reported in a hospital on the island, and it was actually escalated, and the health authorities actually took over, quarantined the person, treated, and the person actually survived. I don't think the person died. So where you have an epidemic or pandemic like this, the government takes over and takes responsibility for monitoring and managing the care. So it's not that we don't play a role. We play a role. At least the patient will have a point to access care if he has health insurance. And from there, escalations can be done and care can be taken to
so that people don't misconstrue that. If you don't have health insurance in a disease outbreak such as this, you can still access care.
Yes, you can.
Okay. Let's talk about the health insurance in Nigeria. Rufai had already, asked you about the coverage level. Yeah. But even to the point that we have coverage, you would still hear many Nigerians complain about the issue of quality, the quality of health they access. And the HMOs are always fingered in this issue. How do you ensure that, even though I'm paying that little token every month for my health, I still access the quality health care that I deserve?
Yeah, thank you very much. Achieving quality is not just the job of the HMO. Mm-hmm. It's a concerted effort. We have all stakeholders in that mix. We have the enrollee of the patient, you have the provider, and you have the health insurance company, and you also have the regulator, be it the insurance company or the medical regulatory body that regulate medical practice. So when we talk about quality, you have to look at it from those four angles, making sure everybody is playing their role professionally, they're being ethical, and they are working together, everybody working together to make sure that the right outcomes, which are already predetermined or set, and that's where quality comes in. If you say quality, you must have standards. So if you say treatment of malaria, uncomplicated malaria, you are saying, okay, treatment with maybe artemisinin-based drugs and recovery within 3 days. Anything beyond that, you start to wonder what has happened with this treatment. So you must set standards, and you expect that protocols, guidelines should be followed. So using that example of treatment of malaria now, What it means is that for somebody to have a treatment that ends up with the right outcome, you must have seen the right provider. That means you've seen somebody that is certified, that is properly trained, that is not a quack. That person should have been certified, credentialed by the HMO and also the regulatory body, and also the licensing bodies like NME and all that. And their licensure is intact and they are practicing properly. Then the person should also follow treatment protocols already prescribed by probably Federal Ministry of Health and all that, and also in line with medical practice, best international practice. Then if this is done, you expect the right outcomes. And once there's a deviation, the patient has the opportunity to seek redress and also escalate, and things can be looked at.
They do complain those take forever.
Well, it depends.
To seek redress and actually get that redress.
It's not supposed to take forever. I think what is important is that everybody should work together to make sure everybody does his part.
No, but concerning seeking redress, I remember many years ago, the federal government set up something called Sevicom.
Yeah.
I mean, how has Sevicom helped as regards this, and what liaisons does the health insurance have with Sevicom?
Now, Sevicom is an agency that tries to drive operational excellence, professionalism, ethics in public service, and you have them in every, public service establishment as like a department. They are supposed to be the watchdog. So when we have complaints, if it's a public institution, you actually can lay your complaint to Sevicom. It will be investigated immediately and issues will be addressed. And I think they've done a good job. I've had instances where people actually complained and the issues were resolved. And I think they should keep it up and make sure that those institutions actually stand and they are independent, because that's the only way they can do their job properly.
Do you think they're not independent enough?
Well, that independence should be maintained and sustained to ensure so that they can do their job and they can continue to hold civil servants accountable where there are deviations from what is expected.
In 40 seconds, if you can, I mean, we have all these public health challenges under the health insurance in Nigeria, but we don't have the major non-communicable diseases such as the cancers. What are we doing in that regard? How do we incorporate those non-communicable diseases where we're seeing increase in numbers?
Okay. Thank you very much.
In like 40 seconds.
Yeah. HMOs are actually working to ensure that cancers are covered on health insurance plans by reviewing plans, by making sure that we look at how to make these things affordable.
Unfortunately, we have less than 40 seconds. Thank you so much for coming on the show this morning.